Okay, then we will continue. So, yesterday we have seen about the general treatment of general treatment of poisoning, in which we have seen five different headings, five different headings under which you will have to take care of a patient with poisoning. So, first is removal of unabsorbed poison. How the unabsorbed poison is to be removed from the body. So how to remove inhaled, how to remove injected, how to remove contact poison before its absorption into the body, that we have seen in detail. Then very important is ingested poison, because large number of cases of poisoning you will get, they will be of ingested poison. So how the ingested poison is to be removed from the stomach, either by inducing the vomiting or by giving the stomach wash. So we have seen how you can go for emetics, how you can induce the vomiting by giving emetics to the patient. So in which cases emetics are contraindicated or you cannot go for emetics. These cases where emetics are contraindicated are corrosive poisons, where the stomach esophagus has been burnt, corroded; strychnine poisoning, Naxomica poisoning, where I just give an example, Naxomica, or any other poison which is having the signs and symptoms of convulsions. Then petroleum or inhaled poison. The inhalation can occur in case of petroleum because of its vapors; and coma or unconscious patient, where you cannot go for induction of vomiting. And we have also seen common household poisons, which is asked as a 2-mark question. Just a draught of warm water, or a tablespoonful of mustard powder, or 2 tablespoonful common salt in 200 ml, that is 1 glass of the water, or 1 to 2 grams of ammonium carbonate in the water. Then apomorphine is a medicine which can be given in the hospital when the patient has been shifted to the hospital and still some amount of poison is present in the stomach. You can take it out by inducing the vomiting by giving him apomorphine, so which is having selective action on vomiting center. We have seen all these things yesterday. Then gastric lavage or stomach wash, I have told you the process. Again, contraindication same: corrosive, strychnine, or anything that will induce the convulsions, coma, and petroleum, unconscious patient, and petroleum or volatile poisons. We have seen in detail about the procedure. First of all, patient should be in prone or semi-prone position with lying on one side, with hip end or head end of the patient slightly higher than head end. Then the stomach tube is to be passed through the mouth gag. A mouth gag is to be put into the mouth so that the tube will not be bitten by the teeth, and through the central hole of the mouth gag the tube is to be inserted slowly into towards the stomach, and this tube should be stiff enough so that it will pass without kinking or without folding. Funnel end at the upper end, and lower end will be blunt and rounded, and lower end will have a few openings on the sides, so that whatever you are pushing through the funnel end through the tube into the stomach, that will be liberated into the stomach through those holes. And whether the tube is in the stomach or not, you can put the stethoscope on the after passing the tube inside. You can put the stethoscope over the stomach region and push some air from the funnel end of the tube. Or if the tube happens to enter, into the respiratory tract, there will be reflex coughing. Patient will cough immediately, and hissing sounds or bubbling sounds of air, or the bubbling of the air, can be found when the outer funnel end of the tube is kept in the water. Then repeatedly the half liter of the plain warm water is to be pushed through that funnel, through the tube into the stomach, and it is immediately taken out. So whatever the poison will come out along with that warm water, that is to be preserved, for further chemical analysis. The process is to be repeated on numerous times. Every time you will have to give half liter of water for stomach wash. Potassium permanganate is also used because it will act as a indicator also. Potassium permanganate will neutralize the poison, so that the violet colored potassium permanganate solution will neutralize the poison, and because of the chemical reaction, this violet colored potassium permanganate will be converted into pink color, and it will be indicative of it has acted with the poison. Then in some cases you can leave some antidote. If you know the exact antidote, some antidote can be left in the stomach, like Maxsulf, magnesium sulfate, sodium bicarbonate, activated charcoal, and liquid paraffin. Liquid paraffin will act as a demulcent, creating the coating over the wall of the stomach. Then while withdrawing the tube should be pinched so that the whatever the fluid that has been left in the tube will not enter while taking it out. It will not enter through the lower end into the respiratory tract, and the inhalation, or what we call it as aspiration, will be prevented. Then second very important thing is use of antidotes, because antidotes is also asked as a separate 5 mark short note. If it has not been asked from general toxicology, if it has not been asked as a 20-mark question, this part it can be asked as a 5-mark short note as well. So use of antidotes is to counteract the effect of poison. Now the antidotes are used when the poison has already been absorbed or the poison has been taken by the route other than ingestion. If the poison has been taken by other than ingestion route, like injection, inhalation and all. Now what are the classes or what are the groups of poisons? Mechanical or physical antidotes. Mechanical or physical antidotes, they will just mechanically, just because of their physical presence, because of the mechanical action, they will prevent the absorption of the poison. They will create mechanical barrier like demulcents. Demulcents will create the coating on gastric mucosa, like fats, oils, milks, egg albumin. They will create the coating over the stomach, and that's why the absorption of the poison will be delayed, and then you can take it out with uh, gastric lavage or vomiting. Then bulky food like banana will cover the glass powder, charcoal will absorb the alkaloidal poisons, and they are to be given. They are to be given when the gastric lavage is contraindicated, and these demulcents or mechanical antidotes will not have any role when the poison has already been absorbed. Then second type of antidotes is chemical antidotes. They will have chemical reaction. These antidotes will have chemical reaction with the poison so that non-toxic compounds will be created. Then general treatment of poison we have seen. uh, Okay, sorry, physiological or pharmacological antidote. Third type of antidotes is physiological or pharmacological antidote, in which the opposite action of the poison is produced. The action opposite to the action of poison is produced. Like in case of stimulation of the nervous system, you will have to suppress it. In case of suppression of the nervous system, you will have to go for stimulation. So chloroform is used, or any anesthetic drug is used, or sedative is used in case of convulsions. The strychnine or Rux vomica poisoning, patient is having convulsions, so you have to go for the medicine which will cause relaxation of all the muscle. Exactly opposite to that, in case of morphine, what happens in morphine? Morphine is a sedative, or it will suppress the higher center. That's why you will have to give the medicines like caffeine. Caffeine is a stimulant which will stimulate the nervous system and will prevent the drowsiness. Then atropine for organophosphorus compounds. Then chelating agents. I think we are seen up to here yesterday. Chelating agents. Chelating agents are specifically used against heavy metal poisoning like arsenic, mercury, lead, copper. So many heavy metals are there. Cobalt and all. Magnesium, manganese. So chelating agents are used particularly against the heavy metals, and they will produce, the chelating agents will produce non-iodized cyclic complexes. Keep quiet, please mute yourself. Uh, they will produce non-iodized cyclic complex or chelates, and examples are BAL, British anti-levisite, also called the dimercaprol, EDTA, ethylene diamine tetraacetate, versinate. It is particularly used in case of arsenic poisoning. EDTA and versinate, this combination is used in mercury and lead, these metal poisons. And sodium N-penicillamine. N-penicillamine is used for mercury, lead or copper, these heavy metal poisons. Now up to here we had completed. Now we will continue. We will continue with fourth type of antidote. Fourth type of antidote is universal antidote. Again it is asked as a 2-mark question. Very commonly, very commonly it is asked as a 2-mark question, as well as it is asked as a your oral exam also it is asked repeatedly. And in the spotting, there are spottings. There are spottings for forensic medicine and there are spottings for toxicology. So in the spottings for toxicology, this universal antidote is very commonly asked. So it is also very common question as well as 2 mark question in the theory. So, what are the indications when we go for universal antidote? So, the name only tells you when the ingested poison is not known. When the ingested poison is, now again I tell you, in universal antidote is indicated in case of ingested poison, the poison which has been taken by mouth, only the poison which has been swallowed. So, in case of ingested poison, when the exact name or exact nature of the poison is not known, हमें पता नहीं ये patient ने कौन सा poison लिया है, या the patient has swallowed more than 2 or more poison, एक से ज्यादा poison अगर उसने अलग अलग तरीके के एक से ज्यादा poison अगर खाए रहेंगे patient ने, तो you will have to go for universal antidote. The name only tells you universal antidote, it will active against many poisons. So it will neutralize, or it will try to neutralize the many poisons at a time. So how this universal antidote is prepared, you will have to remember this combination and how it is administered. It is very simple, very easy, hardly only this much slide is there for universal antidote. So you will have to keep quiet, please mute yourself. Why are you making noise at home? As you make noise in the class, you are making noise in the home also. Please keep quiet, mute yourself. If you have any query, then only you can unmute yourself and ask me the query without. Please mute yourself. Okay, so how this universal antidote is prepared? First is powdered charcoal. The first part of the universal antidote is powdered charcoal. As we have studied in the previous part, it is active against alkaloids. It will neutralize the alkaloids. It is to be taken in 2 parts. Powdered charcoal is burnt toast. Burnt toast charcoal. So powdered charcoal, that is burnt toast, it is to be taken in 2 parts. Then magnesium oxide, that is milk of magnesia, is a alkali. It is a alkali, that is to be taken 1 part. It will neutralize the acid. And third is tannic acid. Tannic acid is strong tea. You know what is present in the tea? Tannic acid, tannin. So this tannic acid is to be taken in 1 part. It will again neutralize the alkaloids and metals. So these 3 substances, powder charcoal in 2 parts, magnesium oxide in 1 part, and tannic acid in 1 part. It is to be mixed. This mixture is to be administered in a dose of 1 tablespoonful in 200 ml water. मतलब 1 चम्मच भर के ये मिक्सचर लेना है. 2 parts of powder charcoal and 1 part of magnesium oxide and 1 part of tannic acid. These 3 things are to be taken in this proportion, 2:1:1, and this mixture is to be added, 1 tablespoonful of such a mixture is added in 200 ml water, and it is to be given to swallow. And if the patient is not cooperative, you can also do it, push it with the stomach tube also. Stomach wash के लिए जो ट्यूब हम डालने वाले हैं उसमें से भी वो दे सकते हैं. So this universal antidote in this proportion is to be dissolved in, or is to be mixed in 200 ml, 1 glass full water, and to be given immediately after the ingestion of the poison, means as early as possible before the absorption of that poison through gastrointestinal tract. Got? So these are the 2 main important points we have seen. First one is removal of unabsorbed poison. By the time when the poison has not been absorbed, after the administration of poison, after the consumption of the poison, if the poison has not been absorbed, how it is to be taken out from the body before its absorption, that we have seen in case of inhaled, in case of ingested, in case of contact poison and all. And how the antidotes will act, or what are the different types of antidotes. So we have seen mechanical antidotes, physiological antidotes, chemical antidotes, and universal antidotes. There are 4 types of antidotes. So when a short note on antidote is asked, you will have to write all these 4 types of the antidotes. Then third step in the treatment of the poisoning is elimination of absorbed poison. Means the poison has been absorbed. And the patient has been brought to the hospital, but the large amount of poison has already been absorbed in the system, and now patient has developed the systemic or the remote action, systemic manifestations, or manifestations of the remote action of the poison, where you cannot go for gastric lavage and all. So if the time is more than 6 hours after the ingestion, the poison has been swallowed, मुंह से लिया है poison, लेकिन 6 घंटे से ज़्यादा टाइम बीत चुका है, so the maximum amount of the poison has already been absorbed through the gastrointestinal tract and circulated in the system. So in this case, you will have to take the measures for elimination of this absorbed poison from the system. So first step will be uh, first step will be to accelerate the excretion of poison, especially through urine. So we give the medicines, or we give the treatment which will improve the excretion of the poison through the kidney. So the excretion of the poison is to be increased, so that large amount of absorbed poison will be carried to the kidney and it will be thrown outside the body through urine or by the sweating. Through the sweat also, some of the poisons are also excreted or secreted into the sweat. So you can go for sweating by applying the hot packs. पेशेंट को रैप करके फोमेंटेशन देके एकदम गर्म एटमॉस्फेयर में, हॉट चेम्बर में वगैरह, ऐसे ही रूम हीटर वगैरह लगा के यू कैन मेक द बॉडी वार्म अप, सो दैट द पेशेंट विल स्वेट. The patient should perspirate, and through that perspiration good amount of poison can be excreted. Then you can go for forced diuresis, means if the patient is not passing adequate amount of urine, many of the poisons will be ultimately carried through blood to the kidney and will be excreted via urine. But it can happen that maybe because of inadequate intake of water or other abnormalities, if the patient is not passing adequate amount of urine, you can go for diuresis. What do you mean by diuresis? When the urine output is very high. So you artificially will have to make the patient to urinate profusely. So you'll have to give the medicines called as diuretics. So you need to give the diuretics like chlorothiazide and mannitol. Mannitol particularly given in barbiturate poisoning. Mannitol is generally given in case of cerebral edema. All of you join fast. Join fast. All are coming. Please join fast so that I can continue. Please join fast. Mute yourself immediately after joining. Please mute yourself. Why you people are making so much noise today? Please keep quiet and please mute yourself. Nisha, Aditi, please mute yourself. Alim, please mute yourself. Okay, Nisha, Aditi, Jivan, Nisha, Aditi, please mute yourself. Okay, I think all are back. Should I continue? Should I continue? Everyone can hear me? Okay, 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 I will continue. So, how to promote the elimination of absorbed poison. So, this elimination of absorbed poison is generally indicated after 6 hours after the ingestion of the poison, because by the time large amount of poison has already been absorbed in the system. So, we have seen by promoting the diuresis, giving medicines, then hemodialysis can be required for barbiturates and bromides or poisons like methyl alcohol salicylates and all. We will study it in detail when we will discuss these individual poisons. You just remember right now the procedure, name of the procedure: elimination of absorbed poison. Then next is general treatment of poisoning, that is the treatment of general symptoms. The treatment of general symptoms. By the time we have seen removal of unabsorbed poison, then use of antidotes. Then third is removal of absorbed poison. So now you have removed the unabsorbed poison, you have used the antidotes also. In the third step you have removed whatever the poison that has been absorbed in the body, absorbed in the system, that also you have removed. Now you will have to treat the general symptoms, not only the those local symptoms, but also the general symptoms of the patient, they also should be there, because in certain poison, the first point only tells you, in the certain poison there can be severe pain. Patient can have severe pain in the abdomen after swallowing any poison, or after swallowing any heavy metal like lead or arsenic. Patient can have severe pain in the abdomen. So your aim, the first aim of your treatment will be to relieve the pain. सबसे पहले patient की pain कम करनी पड़ेगी ना. So to relieve the pain, give a good analgesic like morphine or opiate. Morphine is a opiate, opium derivative. So give some morphine like analgesic which will relieve the pain. Now, irrespective of the poison, you will have to relieve the pain of the patient. Then, oxygen for artificial respiration may be needed, because in some poisons like I will give you some examples like poisonous snake. In case of poisonous snakes, there are three groups of poisonous snakes: neurotoxic, myotoxic, and vasculotoxic. So among those, if there is the bite of any neurotoxic snake where there is paralysis, where there is, because of action of the poison of the snake on the nervous system, if there is paralysis of many muscles, many parts of the body, the muscles of respiration will also get paralyzed. So patient will have difficulty in breathing. You start with that anti-snake venom and all everything that you will have to do as a part of treatment. But if the patient is not able to respire because of respiratory failure or because of respiratory paralysis, you will have to go for artificial respiration. You will have to put a tube. You will have to put endotracheal tube into the trachea or into the respiratory tract, and you will have to attach it to the ventilator. So you will have to go for artificial respiration if the patient is having difficulty in breathing. Then cardiac stimulants may be required in case of failing circulation. If the patient is in a state of shock or the circulation is failing, you will have to go for cardiac stimulants. So these medicines will also be required as a part of general treatment. Then anesthetics for conversion, that we have seen, that is a antidote having exactly opposite action. So if the patient is having convulsions, as happens in Naxomica or strychnine poison, if the patient is having convulsions, what we go for? We go for anesthetic that will sedate the patient, that will anesthetize the patient and will make the patient calm and will cause a relaxation of all the muscles. Then if the patient is having dehydration because of vomiting and loose motions and all, very good example is again arsenic. The clinical feature of arsenic, when arsenic is swallowed, arsenic will cause irritation of the gastrointestinal tract and it will produce profuse vomiting and loose motion. There is one important clinical feature of arsenic poison that we will see in detail when we will study the arsenic poisoning in detail. But I just tell you here for explanation with example. If the patient has swallowed arsenic, arsenic will cause vomiting and it causes the loose motions, cholera-like rice water अगदी पाण्यासारखे. So patient is having repeated large quantity of loose motions. So because of vomiting and loose motion, what will happen? Patient will undergo dehydration. So patient will undergo dehydration. So you'll have to go for plenty of IV fluids. खूप सारे IV saline, IV fluid द्यायला लागतील तुम्हाला, because the patient has been dehydrated by vomiting and loose motion. Then glucose, you may need the glucose for glycogen depletion in the liver, because you know whatever the poison they have been swallowed, they will be carried to the liver from gastrointestinal tract, they will be carried to the liver through portal circulation, and here they will damage the liver, they will disturb the metabolism in the liver. That's why there will be glycogen depletion, that is deficiency of the glycogen in the liver. So you will have to give plenty of glucose to restore that glycogen store in the liver. And also important thing is electrolyte balance. Maybe because of dehydration and all, patient can have severe electrolyte disturbances. They are to be taken care of by administering them according to the signs and symptoms, and of course with the investigations. If there is hypokalemia, that is deficiency of potassium, or hyponatremia, that is deficiency of sodium, you will have to go for administration of these salts, or administration of these elements, because this electrolyte imbalance can affect everything. It can affect the metabolism in the muscle, it can affect even hypokalemia, or deficiency of potassium, it will damage the cardiac, it will affect the cardiac activity. It will also it will affect the movement or normal physiology in all the skeletal as well as soft muscles, because sodium level, potassium level is very important for normal functioning of all the muscles of the body. So you will have to take care of these general symptoms. And lastly, fifthly, maintaining the general condition of the patient. Again, I repeat, you have taken out the unabsorbed when the patient has been brought to the hospital. You have taken out the unabsorbed poison either through vomiting or through gastric lavage or whatever. Then you have used the antidote for absorbed poison. Then you have removed the you have promoted the excretion of the poison by giving hot packs, by diuretics, so that the poison will be excreted via urine and like this. Then you have done the proper treatment for relieving the general symptoms or the condition of the patient in general, to improve the general symptoms. Like for shock, you have given plenty of IV fluids. To relieve the pain, you have given nicely analgesic. To maintain or to control dehydration, to combat dehydration, you have given plenty of IV fluids. Like this, you have given the proper treatment. Now patient is recovering. Patient is recovering from the poisoning. Patient is feeling better now. So then also your treatment is not yet completed. Your job is not yet done. You will have to maintain the general condition of the patient as well. So to maintain the general condition of the patient should be kept warm and comfortable. So his room should be nice, clean and comfortable. Then once the patient is out of danger, once the patient is out of, this is very important, this point is very important, the patient is recovering, patient is improving and has come out of the danger, URTI can occur. It is common in elderly patient and if the patient is unconscious for long period, because so many things can happen to enter the respiratory tract. Even the vomitus can be inhaled, what we call it as aspiration. So aspiration can occur and that's why it can lead to aspiration pneumonitis. So patient can have uh, URTI, upper respiratory tract infection, as well lower respiratory tract infection, because of just I have mentioned here aspiration of vomitus. So because of the aspiration of the vomitus into the respiratory tract, patient can have pneumonia or bronchopneumonia. That's why antibiotics should be given properly. You have done your nice treatment with the poisoning, like removal of unabsorbed poison, removal of absorbed poison, use of antibiotic, taking the general care of the general symptom. So here you will have to maintain the general condition of the patient. You will have to prevent the infection. If the patient is having infection, you will have to treat these infections with proper antibiotics and all. And if it is a case of suicide, very important point, if it is a case of suicide, it was attempted suicide, you should, before discharging the patient, you should consult with psychiatrist, or you can arrange a visit of a psychiatrist with the patient, so that that psychiatrist will console him, will give him proper advice and treatment if required, so that he will not have again impulse to commit the suicide. So to prevent the repeated attempts to do the repeated attempts to suicide, the proper advice and proper treatment should be taken from the psychiatrist, so that these recurrences will not occur. Patient will not again attempt to commit suicide. So this is about the maintaining general condition of the patient after finishing with the treatment of poisoning. So this is all about the general treatment of poisoning, and it is asked as a 20 marks question. So you will have to write in detail removal, I again repeat, removal of unabsorbed poison, removal of absorbed poison, use of antidotes, promoting the excretion of poison that we have seen, and then uh, relieving the general symptom, treatment of the general symptoms like pain, shock, respiratory failure, cardiac failure, dehydration, they should be taken care of, and maintaining the general condition of the patient by giving him good psychiatric support and preventing or treating the respiratory infection or hospital acquired infection can be there. Patient is admitted in the hospital maybe for 15 days, 3 weeks, or even for a month for the treatment of poisoning. There can be hospital acquired infection can be there. There can be simple URTIs, or can be low respiratory tract infections like pneumonitis, bronchopneumonia, because of aspiration pneumonitis. And that should be treated with proper antibiotics and also general care. And for suicidal cases, a psychiatric opinion should be there. to prevent the recurrences of such attempts. So here we have finished with all the general topics of toxicology. आणि आत्तापर्यंत अब तक जो पॉइंट्स हुए हैं, अब तक जो पॉइंट्स हमने कंप्लीट किए हैं टॉक्सिकोलॉजी में, उनमें एक लॉन्ग क्वेश्चन, वो 5, 6 एंड 7 में से एक लॉन्ग क्वेश्चन तो आना ही है. तो इफ यू स्टडी दिस जनरल टॉक्सिकोलॉजी चैप्टर वेरी प्रॉपरली, you will surely get 15 16 marks. So what you will have to write in that, now you might have come to know, अब तक तो तुम्हें पता चला होगा क्या क्या पूछा जाता है उसमें. क्लासिफिकेशन ऑफ पॉइजन आएगा. That you know that 20 mark question can be divided into subsections or sub questions like classify the poisons or define toxicology, classify poison, then give general explain in detail about general treatment of poison, or uh, explain in detail about types of antidotes, or what are the different types of action of the poison, like this, or what are the different routes of entry of the poison, like this. It can be asked in divided question also. So there is always going to be a 120-mark question from this general toxicology chapter, and 2 questions from individual poison. That now we are going to start immediately. We will start corrosive poisons today now. So today we will go to the individual poisons. Individual poisons. So out of them, first, as we have seen in the classification of poisons, first group of poisons is corrosive poison, so which cause corrosion, ulcerations and all. So out of these corrosive poisons, first subclass of the corrosive poisons is mineral acids. Now anyone can tell me the 3 names of mineral acids? Anyone, you can unmute yourself. Anyone will tell me 3 names of mineral acids? Let me see how many people you remember. Mineral acids: sulfuric, nitric, hydrochloric. Yes, very good, very good. Yes, very good, very good. Sulfuric, nitric, hydrochloric, these are the 3 mineral acids. So we will start with sulfuric acid. We will start with sulfuric acid. Again, it is asked as 5 mark short note. All these individual poisons, so many individual poisons are there, they are generally asked as a 5 mark short note. कोई भी पूछा जा सकता है individual poisons में से. So we will see today in detail about sulfuric acid poisoning. Common name. Now we have seen in the definition, how a poison is to be studied. So it is the toxicology, it is the study of poison which deals with its source, its physical and chemical properties, then signs and symptoms, then fatal dose, fatal period, treatment, medical legal aspect, and post-mortem appearance. All these things are studied in detail in toxicology. So in the same sequence, we will study all the poisons individually. So we will start with sulfuric acid. So common name of sulfuric acid is oil of vitriol. You might have seen in chemistry also. So common name of sulfuric acid is oil of vitriol. You might have seen and used this sulfuric acid so many times in your laboratory, in physiology and pathology laboratory. So sulfuric acid is also called as commonly oil of vitriol. It is a colorless, heavy and hygroscopic, oily, non-fuming liquid. Means if it is left open in the air, there will not be fuming. उसमें से ऐसे fumes नहीं निकलेंगे. It is just like water, colorless but heavy. It is colorless, heavy, hygroscopic, oily and non-fuming liquid. It doesn't give off fumes when it is left open in the, or its containers lid or its covering is open. It will not give off fumes. On mixing with water, it evolves great heat. उसमें से बहुत ज़्यादा heat बाहर आती है when it is mixed with the water. And another very characteristic symptom, very characteristic feature of oil of vitriol is it is having great affinity of water. That's why we just, I have mentioned in front of this characteristic, it damages the tissues by dehydration. क्योंकि क्या होगा, ये टंग पे गिरेगा या स्किन पे गिरेगा, बॉडी के किसी भी पार्ट के कांटेक्ट में आएगा तो क्या होगा, it will take out the water. It will take out the water from the tissue, and that's why tissue will be affected by dehydration. So it is having great affinity means attraction, it is having great affinity for water. That's why when it will come in contact with any part, any organ, any tissue of the body, the water part will be lost from the tissue, that will be absorbed by the acid, and the tissue will be suffering from severe dehydration. And again, important clinical thing about the this oil of vitriol or sulfuric acid is the tissues will appear black or brown. Now the color is different in case of sulfuric acid, the color of affected tissue is different in case of nitric acid, and it is different in case of hydrochloric acid. You just remember the affected tissue or the tissue which has been burnt or ulcerated or destructed by coming in contact with the sulfuric acid will become black or brown in color because of charring. Charring मतलब पूरी तरह से जल जाएगा वो, that's why that affected part will become black or brown in color because hemoglobin is converted into hematine. Hemoglobin will be converted into hematine, that's why the affected tissue or affected part of the body will become black or brown. Now, these are the physical and chemical properties. These are the physical properties: colorless, heavy, hygroscopic. Chemical property, it is having great affinity for water, and accordingly will give rise to the clinical features. Now, signs and symptoms. If it has been swallowed, if the sulfuric acid, strong sulfuric acid has been accidentally swallowed by anyone, the clinical features will start immediately. So there will not be any intervening period, what we call it as incubation period in bacteriology, virology, or in parasitology. We use the term incubation period, means after the entry of the microorganism there is some interval between development of clinical feature. That is entry of microorganism and development of clinical feature, बीच में जो time रहता है, that is called as incubation period. But here there is no any such intervening period. The clinical features will start immediately. Once the patient has, that person has swallowed the sulfuric acid, or sulfuric acid has entered into mouth, throat, esophagus and into the stomach, immediately the clinical features will start. So clinical features will start with severe burning pain in mouth and throat. There will be severe burning pain in mouth and throat. As it will go down, it will cause severe burning of esophagus, stomach. Yes, in doubt, any query? Okay, so as that sulfuric acid will go down, patient will have severe pain in the esophagus, severe burning in the stomach, and this pain, this burning and pain will spread rapidly to involve whole abdomen. So this burning pain will spread all over the abdomen, and patient will have violent eructations. So डकार आ जाएंगे उसके, the patient will have violent eructations and vomiting. Then vomiting of black material mixed with blood and mucosa, whatever the mucosa, वो सब जल जाएगा ना, pharyngeal, oral mucosa, सब tongue का covering, tongue का mucosa, inside of the cheek, then pharynx, pharyngeal wall पूरी तरह से, pharyngeal mucosa, esophageal mucosa सब बुरी तरह से जल जाएगा, and that's why the streaks of the mucous membrane will be vomited out. So vomiting of black material mixed with blood and mucous membrane. And because of severe dehydration, as we have seen in the properties, because of severe dehydration, patient will have great thirst. Patient बहुत thirsty हो जाएगा, but cannot drink the water because tongue has been burnt, hmm? Pharynx has been corroded, and esophagus has also been burnt badly. That's why patient will not be able to swallow. Patient will have difficulty in swallowing, and that's why he cannot quench his thirst. So great thirst, but still patient cannot drink water because of difficulty in swallowing, because of that severe pain. And each attempt to swallow causes retching and vomiting. अगर वो थोड़ा सा भी पानी पीने की कोशिश करेगा तो वो तुरंत सब बाहर आ जाएगा. So each attempt to swallow will further cause retching and vomiting. Then there will be severe corrosion of lips, mouth and tongue. मुंह पूरी तरह से जल जाएगा. Tongue, soft palate and all, the oral mucosa, everything will be badly burnt. So there will be corrosion around lips, corrosion of the mouth, that is oral mucosa, and also the tongue. Then mouth is filled with saliva, mucus and all that corroded material. Mouth is filled with saliva, mucus and corroded material, and speaking and swallowing is very difficult because of the dryness and all those injuries and ulcers, all those damages that will cause to the mouth and throat. So speaking will be difficult, and swallowing is very, patient cannot swallow anything. The teeth will become chalky white with loss of polish. अपने teeth normally जैसे shiny रहते, that shine will be lost because of the chemical action of the acid directly on the teeth. The teeth will lose their shiny appearance, so they will lose their polish, and they will appear chalky, chalk की तरह दिखेंगे वो, उनका normal shiny surface that will be lost. So teeth will appear chalky and with the loss of polish, and patient can have difficult respiration. Patient will have difficulty in respiration if some amount of acid has entered the respiratory tract or larynx. If the poison has entered the larynx, the laryngeal edema will be there, destruction of the laryngeal cartilages will be there, and that's why patient will have difficulty in respiration as well. And if there is edema of the larynx, if there is edema of the larynx, the death can occur because of asphyxia. Asphyxia, difficulty in the respiration because of obstruction to the respiration by edema of the larynx. Patient will have difficult respiration and asphyxia. Then vomiting and destruction of tissues. Vomiting and destruction of tissue will cause great weakness. Patient will have severe exhaustion because of that severe pain and weakness. Patient will be exhausted and patient will collapse. Patient can go into shock. Now you will come to know what we have studied in the action of the poison. All these action we have studied here, that is corrosion and burning of the tongue, soft palate, oral mucosa, pharynx and esophagus. Which type of action it is? Which type of action it is? Anyone? Whatever the action of the poison has occurred on the mouth, on the pharynx, on the esophagus, on the stomach, which type of action it is? It is local or remote action? Yes, it is the local action. Yes, it is the local action because still the poison is in contact, directly in contact with the mucosa of the upper GIT up to stomach. That's why it is a local action. But now the patient has, because of severe pain and because of vomiting, the patient will have great weakness. Patient will exhaust and will collapse and will go into shock. Which type of action it is? It is general action. This is, I'm not saying remote, I'm not saying remote action. This is the general action of the poison. Because of severe pain and because of great weakness, patient will collapse and will go into shock because of pain. That is general type of action. Now next point to be studied after clinical features is fatal dose and fatal period. Now I tell you one thing, any of the poison can be asked as a 2 mark question. Now out of those 15 questions, you know, 7 to 8 questions are from forensic medicine. Out of the first 15 question, question number 1, 15 2 mark questions are there. You will have to attempt 10 out of them. So 7 to 8 are from forensic medicine and 7 to 8 are from toxicology. तो उसमें दो क्वेश्चन तो फैटल डोज एंड फैटल पीरियड की होते हैं. यू विल हैव टू गिव प्रिसाइज आंसर. इट इज जस्ट लाइक मैथमेटिक्स. यहाँ तुम गोली नहीं चला सकते, अंदाजे से नहीं बोल सकते. इट इज जस्ट लाइक मैथमेटिक्स. यू गिव द प्रिसाइज आंसर इन 2 words, you will get full 2 marks. You will get 2 full marks if you are given the precise answer. So you will have to remember the fatal dose and fatal period of each and every poison, because any poison can be asked for that. So many poisons have been asked, means every time the new poison is asked every time. So accordingly you will have to prepare. You will have to remember the fatal dose and fatal period of each and every poison. So fatal dose of sulfuric acid is 10 to 15 ml. Now what is fatal dose? Fatal dose is that minimum dose of the poison which is required to kill an average sized adult. एक adult आदमी को मरने के लिए कितना poison जरूरी है, minimum dose. So for sulfuric acid it is 10 to 15 ml. So if any patient swallows 10 to 15 ml means hardly एक घूट भी नहीं, एक घूट से भी कम, so less than 1 sip. If any patient swallows 10 to 15 ml of sulfuric acid, that patient can die. And fatal period means entry of poison into the body and death of the person. तो उसको एक्शन पूरा होके, वो पॉइजन का एक्शन, साइंस एंड सिम्टम्स आके वो पेशेंट कितने टाइम में मरेगा. So that is fatal period. So death occurs within 12 to 24 hours from shock or from suffocation or perforation of the stomach. या तो stomach पूरी तरह से फट जाएगा because of the damage to the mucosa, submucosa and all. The stomach can undergo perforation. The acid and all the gastric contents will leak into the peritoneal cavity. Patient will develop peritonitis and will die within 12 to 24 hours. So fatal dose is 10 to 15 ml and fatal period is within 12 to 24 hours. 24 घंटे के अंदर वो आदमी मर जाएगा. Now we'll see the treatment of sulfuric acid poisoning. So treatment, as we have seen in case of corrosive poisons, stomach tube and emetics are contraindicated. You cannot go for stomach wash or gastric lavage. Gastric lavage is contraindicated. एमेटिक्स आर कॉन्ट्राइंडिकेटेड क्योंकि वो सब जल चुका है, उसका मुंह, गला, pharynx, esophagus, everything has been burnt, ulceration, there can be even perforation of the esophagus. So stomach tube and emetics are contraindicated, but still you can pass a small stomach tube within an hour of ingestion. थोड़ी देर के बाद डाल सकते हैं अंदर. Alkaline carbonates are contraindicated because we have seen in case of treatment of acids you will have to go for alkalis. They will have chemical reaction with each other, what we call it as chemical antidote. So alkalis will neutralize the acid, but here alkaline carbonates are contraindicated in sulfuric acid because they will liberate carbon dioxide, and large amount of carbon dioxide can get inhaled or absorbed into the system and will cause further damage. That's why specifically in sulfuric acid, alkaline carbonates are contraindicated because they liberate large amount of carbohydrate because of chemical reaction. Milk of magnesia. Milk of magnesia will neutralize the acid. So through that soft stomach tube, you can put milk of magnesia, the solution of milk of magnesia. So whatever the acid that has been left in the stomach, that will be neutralized. And if milk of magnesia is not available, you can go for wood ash, bhusa, lakdi bhusa, wood ash, or lime water, or soap water can also be, because soap is a alkali. Soap is a alkali, so you can go for soap and water can be used if this milk of magnesia is not available. Then later on you can add the milk or beaten eggs can also be put to neutralize the acid. Then patient is having severe pain, मुंह जल रहा है, गला जल रहा है, पेट में बुरी तरह से पेन है, patient is having severe pain, so to relieve the pain, so you can go for morphine की injection देने पड़ेंगे patient to relieve the pain in the abdomen. Then ice suck, because patient is not able to swallow, and patient को इतनी thirst है, patient को इतनी प्यास लगी है, but patient is not able to swallow anything because of the severe pain in the mouth, throat and stomach. So you can give ice suck. तो उसका thirst और उसका जो उसका जो thirst है, unquenchable thirst है, वो temporary relieve करने के लिए तुम बर्फ का टुकड़ा उसके मुंह में दे सकते हैं. That will cause cooling as well as it will relieve the thirst, maybe temporarily, but ice suck can be given. Then IV fluids to maintain to combat the shock. If the patient has developed shock-like condition, you will have to go for plenty of IV fluids. And if his laryngeal edema is there, larynx has been obstructed, you will have to go for tracheostomy. Tracheostomy means making the incision below the larynx. Below the larynx, trachea में हम एक incision बनाते हैं और उसमें से अंदर ट्यूब डालते हैं, and then we go for artificial respiration. So this is all about the treatment part. Go for alkalis, then go for morphine to relieve the pain, ice suck for dehydration, IV fluids for shock, and tracheostomy if there is laryngeal edema, patient is having difficulty in breathing, you can go for artificial respiration because you cannot put the endotracheal tube from mouth. So you have to go for tracheostomy. A small incision is to be made on the anterior part of the upper cartilage, just below the larynx, upper cartilage of the trachea, and you can put the tube through that and go for artificial respiration. Okay, then we will stop here. We will see medical legal aspect and further poison, medical legal aspect of sulfuric acid in the next lecture. Uh, okay, then today we will stop here. I hope all of you have understood. Everyone, everyone has understood. Okay, very good then. All of you are attending. I hope you are not just leaving the mobile somewhere and doing all your jobs here and there at home. You are attending and listening the lecture properly. Let us hope for the best. Okay then, see you. I will stop here. See you tomorrow at 3 p.m. Okay then, I will end the meeting for all. Bye everyone. Bye.